Blood glucose levels rise within minutes of eating and tend to peak within 1 to 2 hours. To maintain controlled blood glucose levels, pancreatic beta cells release insulin. Binding of insulin to its receptor promotes the translocation of GLUT4 glucose transporters to the cell surface and increases the cellular uptake and storage of glucose. In patients with type 2 diabetes, dysfunction of pancreatic islet beta cells and resistance to insulin lead to elevated blood glucose levels. A closer look at insulin secretion during meals, called the incretin effect, involves the release of two important incretin hormones from the gastrointestinal tract, GIP and glucagon-like peptide 1, also known as GLP1. However, in patients with type 2 diabetes, the incretin effect is significantly reduced or completely absent. GLP1 binds to pancreatic beta cells and promotes insulin secretion in a glucose-dependent manner. As GLP1 is only able to stimulate insulin release when blood glucose concentrations are above fasting levels, the actions of GLP1 are self-terminating and unlikely to induce hypoglycemia. GLP1 also inhibits glucagon release, thereby inhibiting the breakdown of glycogen into glucose. Additional benefits of GLP1 include delaying gastric emptying, increasing satiety, promoting beta cell proliferation, and reducing beta cell apoptosis, thereby preserving and enhancing functional beta cell mass. The effects of GLP1 on beta cells may improve glucose homeostasis over time, particularly in patients with type 2 diabetes, who at diagnosis have about 50% reduction in beta cell mass.